We are live on YouTube. We are live on YouTube. Somebody type in the chat what we normally type into the chat to remind people to make a note there. We are live on YouTube. Somebody type in the chat what we normally type into the chat to remind people to make a note there. Adding music, hang on. Somebody type in the chat what we normally type into the chat. Adding music, hang on. I'm just trying to do right. Oh. Forgot about that. Okay. Sorry, Sue reminded me that we're getting feedback because we're getting not only what I say, but what I say 15 seconds later.
A little confused.
Right now I'm showing 6 of us on the screen, so whatever you're doing, everybody looks nice. Everybody dressed up nicely. Looks good. I like my picture better than that other feed. Should be all right with a $400, $500 webcam. Okay, I'm just going to experiment with speaker view for a second here. And I'm going to ask everybody to speak up at some point. We're about 3 minutes to live on Podbean. So, Alex, you next.
Test. Checking.
Go, Ann.
I'm here. Can you hear me?
I can hear you. Just looking to see if your feed comes through. It did not. Go. Can you speak a little louder?
Yes. Can you hear me now? I sound like a Verizon lady.
There you go. We got you.
Okay, thank you.
Go, Mark.
Hey, John, can you see me? Hear me?
Speak a little longer.
I'm sorry. Oh, you want to test it just a little bit longer?
Yep. I got you. Judy?
Good.
Hi, everybody. This is Judy. Can you hear me, see me?
We can. Sue?
Hi, this is Sue. Can you hear me okay?
Try it again.
Okay. Let me look.
She's so quiet. I'll bump her mic up a little bit. Yeah, you might want to put the thing.
Okay. This is Sue. Can you hear me better now? Okay.
Try it again.
Should I yell? Here, let me get it. A little bit more. This is Sue. Can you hear me okay now?
Speak a little longer so the camera can change.
Yeah.
Oh, okay.
just keep
This
going.
is Sue. I'm talking. I think I'm talking pretty loud.
It's not. It's never gonna
I'm-
change, John, because she's locked in on yours. Her audio is coming through you.
I can hear her fine.
Oh, you're right.
We're fine.
Yeah, but her audio is going through John, so her picture's not gonna show up on YouTube.
Oh, shoot. You're right. I don't know how to fix that because otherwise I lose control of the board. Well, thanks for reminding me. Okay.
I thought I was the muty thing or not.
I will. I got to do that next.
Okay, but
Congratulations, Sue. You don't have to be on YouTube.
Second. Jenna, can
I
you?
was just
Can you
thinking to myself, how do I get me on his audio so they can't see me?
if you don't want to be seen, just cut your video. Jenna, can you talk?
Testing, can you hear me?
I can. I just don't know if that actually goes out to the feed. We're coming up on.
it's not letting me
It does.
enter.
So that's the problem. Is that when? Okay. Yeah, I'm going to go back to the main feed. So at least now I know how it works. Okay. We're going back to the 6 on live. So what I'll do, Sue, is I'll cut to, when you're talking, I'll put the 6 on the screen and then we'll go out. So we'll go like this. See how it goes. Okay, we're going live with Podbean. Stand by. We are live with Podbean. Stand by for announcement. This is John Goehle with the ASC Podcast with John Goehle. Welcome to the March 27th live edition of the ASC Podcast with John Goehle. We will be going live in approximately 9 minutes. On the private chat, can somebody type in the numbers from YouTube?
Did you need to test my mic as well?
No, actually,
Okay.
Yeah, no, we're all set. Sorry about
Gotcha.
Interestingly, we actually have nobody on any of our feeds. It's kind of strange.
I find that hard to believe.
This is John Goehle with the ASC Podcast with John Goehle. We are at 7 minutes to going live. Oh, well, welcome, Lori. That wasn't me, no.
Hi, John.
Yeah, I didn't read it. I'm sorry. I just had to have I'm so sorry. For those on the feed, notice that statement from AAHC about the change form not being necessary. Let's have, who wants to speak about it?
Jenna does.
Okay, Jenna. Can somebody put it in the script for Jenna? This is...
Who are you talking to?
I gotta get serious here. Hang on.
Oh my God.
This is John Goehle with the ASC Podcast with John Goehle. We are at 5 minutes to going live. At the present time, I'm speaking to myself because, and all of us, because there is nobody else on our feed.
I don't know that Mark would feel that way.
Do you want me to do the-
Yeah.
And
yeah,
I can
just
put it in just after the announcement, and then we banter. Put it kind of banter.
Yeah, yeah, perfect.
All right, I can just kind of quote that.
Lori, just to note, you are on live on the feed, your video. So
You want me to turn off?
no, no, just come here.
Just
that's
want
all.
you to know. Steve,
I, for one, am
you
happy
put
to
up
see
with him.
Lori.
Yeah.
I don't put up with them. I don't listen to them. But this way I can raise my hand.
Yes.
Good point.
Mhm.
Okay, we actually have listeners, so welcome.
So behave.
So behave, everyone. Welcome, listeners. This is John Goehle with the ASC Podcast with John Goehle. We're coming up on 3 minutes to going live. Alex, first, thanks for reminding me about Audacity.
Did it too early, didn't I?
It's all right. We're live with Audacity. Okay, so here's the good news. We have all our backup systems working today. It's a 2-minute warning.
That may be where everybody is, because it's Friday.
I was just thinking that. I think everybody's gone to happy hour already.
Well, I think if they're closing, they may have chosen Friday.
Yeah.
Yeah.
We're at 1 minute. We're at 10 on the audio feed. We're at 30 seconds. Stand by for live.
Welcome to episode 98 of the ASC Podcast with John Goehle for March 27th, 2020, recording live from our studios in Spencerport, New York. We would like to thank our sponsors, Ambulatory Healthcare Strategies, Surgical Information System, Encompass Healthcare Data Solutions, and BHG Funding. For more information about our sponsors, please visit our website. This is Susan Cronkite, Chief Researcher of the ASC Podcast with John Goehle and Senior Nurse Consultant for Ambulatory Healthcare Strategies. Joining us from Studio One is John Goehle, recognized as one of the nation's leading experts in the ambulatory surgery industry. Joining us remotely from Rochester, New York, Jenna Alvarez, Senior Nurse Consultant with AHS, Alex Borneman, Director of Operations with AHS, and Judy D'Ambrosio, Director of Educational Services with AHS. And from Cape Cod, Massachusetts, Lori Rodricks, Director of Clinical Services for AHS. From Atlanta, Georgia, Zach Kelleritis, Financial Consultant with AHS. From West Palm Beach, Florida, Ann Geyer, Chief Nursing Officer with SIS. And from Atlanta, Georgia, Mark Smith, CEO of Fundex Solutions Group. So happy Friday, everybody. I guess I don't know if we can really say happy Friday, but it's Friday.
It is Friday. It is indeed. So I do want to introduce what we now refer to as the Ambulatory Healthcare Strategies Coronavirus Crisis Management Team. So I just decided to kind of brand it.
That's quite a mouthful.
And we have Ann here who doesn't actually work for our company, but it seems like she does with all the time that
Feels
she's
like it, yeah.
But thank you, Ann, for joining us, and our special guest Mark, who's joining us from Fundex Solutions Group. Given everything that's going on with our financial situation, we thought it would be good to have somebody to talk about some of the options out there. You know, since the coronavirus began, Ambulatory Healthcare Strategies and the ASC Podcast with John Goehle have really led the ambulatory surgery industry with regular updates, policies, forums, succinct advice, and regular live podcasts and interactive discussions. No other industry sources come close to our coverage. And as a family-run business, Ambulatory Healthcare Strategies and ASC Podcasts have always operated with the very simple philosophy, whatever it takes. Our staff is exhausted. Our dogs feel neglected, except for our new puppy. And, of course, the cats really don't care. But please know that we are giving it all, and we are looking forward to our Friday here. I do want to thank all of our clients for their patience and support during this stressful time, and hope that those of you that are not yet clients will see us as a valuable addition to your team moving forward. Note that our listenership has increased dramatically. We're actually averaging 280 per episode. In the last 4 days, we've had almost 400 downloads, which for a very small industry like ours is actually pretty incredible. So again, thanks for your support. As you're listening to today's podcast, there's two ways you can do that. You've already figured out at least one of them, obviously, if you're listening to me. One is through Podbean. It's an app that's available on your iPhone or your Android device. If you are using the Podbean app, you can type your question into the chat. And we do see them here. We have a couple people monitoring that, and we'll bring that question up right away. If you're too shy, you can also email us at comments@ascpodcast.com. And you can also be joining us by YouTube if you wanted to see the wonderful video feed of this, which has, at the present time, 7 pictures of 7 different people in 7 different locations. Well, 6 different locations. And there's also a way to leave comments inside of the YouTube app. And if that doesn't work, and if you're one of our clients, you certainly have a contact number. Don't call me or Sue if you don't mind, but you can call any of the other people from the company, and we'd be glad to at least write down your question and put it on. We take questions throughout. We'll try to fit it in at the appropriate time. And that's it. So, for questions, we're really encouraging as many questions as possible. We do have quite a bit to talk about today, since we haven't been on since Monday. As we were going live, we did get some clarification for HHC. So, Sue, why don't you explain what we just learned?
Okay, so we've been talking to our clients about the submitting a HHC change notification form if they're closing, but we just received some new clarification on that. And so I'll just quote from our email. For service scope changes, including temporary closures, suspension, and expansion of services directly associated with COVID-19, requirements for submission of the HHC change notification is waived until further notice. And then they suggest that for all facilities, if your primary contact changes during this time, email HHC at notify@hhc.org. They just wanted to make sure that they can reach you if there is any change to that. So that's.
I will point out. Sorry to interrupt, Sue.
That's okay. Go ahead.
I will point out they also did say, because there was some confusion if you listened in or if you, from our emails, I think we talked about when we had been submitting them, people had been getting a response saying they wanted to be notified of any COVID-19 confirmed cases. And they did clarify that in the frequently asked questions that they sent us. The question was, how and when do we report COVID-19 cases to HHC? Once a week, right before the survey? Like, what do you want us to do? And the answer was, for organizations with a pending survey or within 14 days of a completed survey, they must notify HHC of a suspected or confirmed case as soon as possible by contacting HHC. And they gave a number, 847-853-7485. So it's for the safety of their surveyors that it looks like they're looking for that information. They don't want to know about every case you ever have. Just if you're expecting a survey, they want to keep their surveyors safe.
Makes sense. Thank you.
Judy, do you want to talk about TJC and HFAP?
Sure. As far as change notifications, we have a few clients that are accredited by people other than HHC. So not just me, but I had help. We reached out to Joint Commission that doesn't have a place within their system to put in a change notification, but they want you to contact your primary account executive, and they will guide you through the right way to get that done. And as far as HFAP, I haven't really heard how they're handling it or what they're doing, but I have somebody out there trying to figure it out for me. And as soon as I hear, I'll let people know.
Okay.
I think we only have one client that deals with that.
Correct. Okay, thank you. Okay, sorry. We're actually going to start with what I think is a very important issue right now, and that's why we put it first and foremost here. And we asked Ann to be on today to kind of talk about the mental health side of this, shall we say. In other words, how are we taking care of ourselves during this? How are we taking care of our employees? So go for it, Ann.
Well, I think that I made several notes before we started. And as I mentioned last week when I called, I was really talking about what I do, but I've done a lot of thinking about it and I've added some things to it. The first thing that I recommend if you're feeling really, really stressed is exercise. And I have to tell you, in our neighborhood, which we're not under lockdown right now in West Palm Beach, but I've never seen so many walkers, dog walkers, runners, exercisers, people that, and I've lived in this neighborhood for 3.5 years and I'm always out walking, people I've never seen before. So obviously that you just need to get out, and getting out, exercise. We're all going to be slimmer when this is over if we do that. And there's different times of day, even if you're working from home and you're working remotely. Maybe you're a morning exerciser. Maybe you're an after work exerciser. If you're working remotely and you exercise at noon, then you can work later in the evening because there's no time clock for you to punch in and out of. So consider that. Now, my husband hates this next one. Tackle big, tiring projects. So I have a COVID-19 to-do list, okay?
Of course,
and it's in my computer. I know. He hates that. And it's in, for those of you that are laughing that know me, you know I do have one. And I'm looking at it, and it's stuff like clean the closets, throw out all the old paperwork in my office, hang pictures in my office, clean out the refrigerator bins. I mean, the list is half a page long right now, typed, but it kind of keeps you on track. So, and it's stuff that you always said, I don't have time to do it, but if I'm ever at home, I need to do whatever. Yeah. So start your list. Read a good book. All right. When I was in graduate school, I didn't get to read at all. And I kept thinking, okay, when I get out of graduate school and I graduate, I can't wait to read. Well, I felt like a deflated balloon when I got out of graduate school. And all of a sudden I had time and I didn't have the initiative to read. Now's the time. And if anybody needs some good books to read, you can contact me. I'll send you some of the ones that I've been reading recently that I really do like. And I'm serious about that. I also listen to Audible books when I exercise so that I'm flying through books. I have a written book that I'm reading, and then I have the Audible books. Now, this next one may not be for everybody, but back in the 80s, I had a friend who hated to do the treadmill. He hated it. Now, we're both Catholic, So he said to me, you know what I do when I'm on the treadmill? I say the rosary. Well, in this day and age, and I've done that ever since, but in this day and age, if you're spiritual at all and you pray to whichever God you pray to, consider praying, start a dialogue. We need all the help we can get. We need that angel sitting on our shoulders, keeping looking out for us. Okay, another one. Touch base with your old friends. I say this because I don't know if I mentioned this when I spoke earlier this week. 2 days ago, I called my priest friend in New York City, the epicenter of the virus, just to see how he was doing and how he was coping. And then I called another priest in Vero Beach that I know, and he said they're all driving each other crazy there. But every day I'm trying to call and talk to somebody that I haven't spoken with in a while, so that just to touch base. I was just watching TV in the background, and the speaker was saying that people need a connection. They need to feel that they have somebody to talk to. I'm an extrovert. I think the thing I'm missing more than anything is the connections, the real life connections with people. So this morning, before this call, we were talking about how to set up a Zoom account. Another friend of mine said to me that her daughter set up a Zoom account for the family. And every night, all of them get on Zoom and have a live video chat. So they can see each other, the grandkids are on it, so consider that. The other thing is to keep up with a daily routine. We all need a reason to get up in the morning. If you don't have a reason to get up, then you can just stay in bed, then you can't get motivated. So what would that routine be? Well, my son has 3 little kids that are now at home, and he's working from home, and his wife's working from home. They set up a schedule from 8 to 3. That's the school day for the kids. They have a schedule of things that they have to get done before 3 o'clock, and that's what they do every day. I saw John Tesh on TV last night, and he was in a coat and tie. I don't know if any of you saw it. And he said, I'm actually in my basement, and I was in my gym clothes, but I made myself put on a coat and tie because it gave me a reason to, I knew it was going to be on TV for people to see that I was working. This is work. I'm not just doing this for fun. Call a hotline if you need help. I know that this morning in Florida, they had a link to a hotline in the local area, excuse me, that people could call. And it may not be, we're not talking about a suicide hotline. We're talking about, I'm feeling really closed in right now and I need to talk to somebody. There are people out there that don't have anybody to talk to. They don't have family. They don't have friends. Some of them may be your staff. And when they go to work every day, that's their social network. So what are they doing every day? Do something fun with your staff. On the days that you're open, maybe you're only open 1 day a week now. Well, that 1 day a week, you buy pizza. Next week, you get takeout Chinese. Now, John and Sue, you'll love this. Spend time with your pets. They will always love you, always, whether they're cats or dogs or iguanas. But they'll always, I don't know about the iguanas loving you, but the dogs and cats will. And if you don't have a pet, consider fostering a pet. We had a big article in our paper this week that you can foster dogs from our local shelter, especially for older people, and it's just made a lot of difference in their lives. I just think it's huge. I think something else that just came up on our note page is religious services on Zoom. All of our religious services are canceled right now, but if you go on Zoom, you can get your local church service probably online. Now, that's not everything, but John, you mentioned a happy hour.
Yeah, well, first of all, going back to the church service, for those of you who don't know, I'm also a Presbyterian minister, and we started about 3 weeks ago going through Zoom with the various services that we have. And what we did in Western New York is we actually banded together, I think it's up to 5 churches now that are doing a Sunday service. Well, we're actually recorded on Saturday and presented on Sunday. We're having some problems with the live feed, but it's very, you don't have to be religious really to appreciate the this type of a spiritual connection. So it's a good way to try to.
No, I agree. I actually listened to Cardinal Dolan's Mass on Sunday from St. Patrick's because I happen to really like him, and he always has an upbeat attitude, and that's the Mass I chose to listen to. I think this is a list of stuff that I recommend And I would love to hear from the rest of you what you think. Lori, I think you were having something to add.
Before I said that, I did want to mention the happy hour, though. One of our clients in Watertown, I think it's Judy's client, they today is their last day, right? Or was it I'm not quite sure when it was, but they decided to get together on Zoom and have a happy hour. Can you tell a little bit about it, Judy?
I had done their mandatory education, their annual education over Zoom, and none of them had used the platform before. So as each of them logged in, they were very surprised that they could all see each other. And one was holding up this kid and holding up the puppy, and oh, look at my new bathroom, and carried her laptop in there.
Yeah.
And they all just love the concept and says, well, we're not going to be together for a while, so why don't we on Fridays do this? And I taught the one girl how to do it, how to send. She goes, then we can pour ourselves a drink and sit in our own house and pretend that we're together. I think they're going to need that. When you work every day with the same bunch of people all the time, you become really emotionally connected, whether you want to believe it or not. As I look at all of your little faces, you become really emotionally connected to those people. And if you're separated from them, it's a hardship. It's difficult.
Yeah.
Lori, go ahead.
It's funny, based on what Judy was talking about, I was texting back and forth with my sister. She's down in the epicenter in Manhattan with her family. And I said to her, hey, maybe we can FaceTime and have happy hour. So that's something that we're going to look into. And then, then we can just sit and chat instead of just, texting back and forth. But I have to say that I am a born again Weight Watcher. And they have all of their meetings on virtual meetings now. So, to keep in touch with all of their members, and I can't get over the number of people that have taken that up, and it's amazing. So there's a lot of things that you might do. Even fitness clubs, such as Planet Fitness, has a nightly, thing on the web that you can join to exercise at home. That's free, I guess, to its members. I'm not sure if it's free to everybody, but it's just, think outside the box when it comes to socialization. I think that will be helpful, between family and friends and, and then your activities. That way you don't just stay in bed for 6 weeks,
That's right.
Well, the thing is, if some of our staff live at home and they're alone, they don't have roommates, they don't have a spouse or significant other, who are they talking to all day long? You can only talk to your pets so much without starting to feel like you're, there's a second head in your brain or something. But no, I think anything that we can do, any suggestions, it'd be interesting to see, John, if the people on this call could reply with what they're doing to get through it, because it may be something none of us geniuses have thought of.
Yeah. And my sister sent me a link from Princeton, where she works at. They had gathered a whole bunch of resources from libraries to museums, and people can just go search for these things. And, a lot of people are doing art projects online and, virtual tours. Almost whatever your interest is, I think you can find learn something.
No, you're right.
As a matter of fact, as for those of you that don't know or haven't listened to our previous podcasts, we do have a new puppy in the house, and we are spending so much time with her that she is now trying to find places in the house to hide from us. So
Come back.
it's like,
I'm taking my little. I walk during the day, and then at night, my little Chihuahua had lost her little waistline. And so we've been taking Tinker along Flagler Drive. If any of you know anything about West Palm Beach, it's all along the water. When the sun starts to set, the one dog's too old, so Carl takes care of her and just holds her and does little stuff. And I walk Tinker. She walks faster than I do. People comment that she's walking me, and we walk 2 miles. I've clocked out a 2 mile, path. She loves it. So she'll slim down for sure.
Okay, well, I guess we're going to have to talk about the real stuff now. So ASCA, the ASC Association, did issue a report on surge capacity. Released a proposed plan for ambulatory surgery centers to assist the local hospitals. And the proposed plan includes 5 options and the regulatory changes that would be necessary to allow those ambulatory surgery centers to help in this area. So very interestingly, nothing concrete, but something to keep an eye on. For a full list, it will be available on our website. I believe it'll be available on our website. So just an FYI, here's some of the ideas. Option 1 is ASCs can take outpatient surgical elective, urgent elective procedures now, as we are best positioned to do this. And this is really the highest and best use of our capacity, because that's certainly what we do every day. So you can take on urgent surgeries from the hospital at an ambulatory surgery center. You can take on emergency fracture surgeries, for example, except for hip fractures. Option 2 is ambulatory surgery centers can transition to accommodate complex surgical cases. In other words, migrating overflow surgical case volume, both inpatient and outpatient. Option 3 is ASCs can expand the services to meet the different needs you have based upon the assets that you have in place across the country. So, for example, you can be a triage center, you can serve as an infusion center, which I think is a particularly good use of a ASC. Provide inpatient overnight beds, which we know we generally can't do. We can become a birthing suite, which is not a high priority item, but it certainly would not be a bad use of our centers. Or you can serve as an urgent care center for non-COVID-19 patients. The fourth option that ASCA suggested was ASCs can further expand their services to meet the community's needs. So, and once these are employed, it would be difficult to go back, providing the services in options 1 through 3. So in other words, once you do this, you might be cutting out those previous things we discussed. And in this situation, you could be a COVID-19 testing and triage center, or you could act as an ICU setting for these patients. Again, it'd be difficult to go back because at this point you'd be directly taking care of COVID-19 patients. And the fifth option, and kind of the lowest priority, but certainly another option out there, is the facility and or the resources used, not providing medical services within the facility, but become things such as a sleep center for a hospital, call teams, or provide resources, staff, and equipment only. That's not the best use of our time, but at least you're using the center for something. Let's talk briefly, Jenna, about the ASCA demographic form. So ASCA also proposed a demographic form that could go with the letter. So remember, on Monday, we suggested that you reach out to your hospital and that you you discuss with them what you could do for the hospital. Jenna, go ahead.
So this form is a good thing to send along with your communication to the hospital or to your local emergency management office through your local government. And it has just basic demographics about where your facility is located, the number of staff you have available, the types of equipment you have available, like if you have x-rays machines or C-arms, crash carts, IV pumps, wheelchairs, etc. Also the number of operating rooms, pre-op beds, PACU beds that you have, the availability of decontamination or sterilization, and the medical gases you have available, and the PPE you have available.
And that form is available on our website at ascpodcast.com. I guess I didn't mention that before, but we try to mention it a couple of times here. There is a lot of information up at ascpodcast.com, and just follow the links on that page. We're giving a lot of information out, and a lot of forms, a lot of policies, a lot of things that could help you get through this crisis. We don't talk about them in every episode, obviously, and certainly going back and listening to previous episodes will help you to kind of see what we prepared for you and provided to help you get through this crisis. So that's at ascpodcast.com. We did reorganize the setup on, I think it was on Monday or Tuesday, to make it a little bit easier to use. That as things go on, the way we had formatted it before it became less relevant. So it is more subject oriented than it had been in the past. Judy, why don't you talk about the ASC Sorry.
No.
Oh, I'm sorry.
Sorry.
Thought we had a question. Sorry, Judy. Why don't you talk about ASC quality reporting?
Okay.
Okay. We got word earlier today, I think, that for those of you that are involved in the quality reporting part of this, that the centers, well, CMS has decided that the ones that would be due in May, on May 15th of this year, covering last year, 2019, they're not going to make those mandatory. I mean, if you choose to, you're welcome to, and that information will be made public. And there will be no payment penalties assessed if your ASC does not report. So just so you understand, CMS announced it's granting an exception for the reporting requirement. Has given some of the reporting extensions, but the ones that we normally do, 9, 11, 13, there just is no reporting for this year. For those programs with data submissions deadlines in April and May of this upcoming April and May, they will be optional based on whether you decide you have the time, ability, staff to do that. If you do that, they will still use that information to make public. No data reflecting services from January 1st, 2020 through June 30th, 2020 will be used in the calculations for Medicare quality reporting. So that's one less thing you need to worry about. If anybody had even thought about that in the last 3 weeks. I know we hadn't thought about it until earlier this morning when we started to have this conversation.
Thank you, Judy. Lori, you listened to a webinar yesterday from AORN regarding some infection control issues, and we tried in our morning update to at least kind of give a brief overview of it, but there was a lot of information. Can you kind of summarize it in less than 5 days of information?
I was just frantically trying to type it up. All right. So I'll break it up into I can break it up to 12 categories, but let's just start with, if you are currently performing procedures, some of the things that they recommended is that the use of the N95 respirators, if you have them, they're recommended just to be used in the event of patients with known or suspected COVID-19, number one. Number two, they're also recommended if you're going to be doing any procedures that could potentially cause droplet or respiratory contamination, such as intubation, extubation. If you are going to be performing any procedures on the nose, the mouth, the lungs, the chest, they talked about any kind of scope procedures that might go into your thoracic cavity, which hopefully many of us are not even thinking about, but stuff like that. They also recommended that if you'll probably minimize the number of rooms that you're using. So keep those rooms as your constant room, and if possible, remove as much equipment out of the room that would not be needed, so that you're not having to constantly clean it and avoiding it getting contaminated with droplet, spit, whatever. The other thing is that if possible, if you could have a runner available to assist the circulator so that he or she is not in and out of that room, constantly opening the door, causing that, the air in that room, which is now open for contamination, to try to contain it as much as you can. If you have the luxury of having an ante-room in your operating room, utilize that way to pass equipment in and out, as opposed to the main corridor, so that it's not open to everybody's walkway, if that makes sense. The other thing they talked about is the very thorough cleaning, before and after your cases. The other thing is that once the patients are intubated, they reminded people that that's a closed system, so you don't have to worry that they are passing droplet or respiratory contamination that way, because they should have the closed system based on the machines and the ventilators. They discourage the reuse of masks and the PPE, but there are ways to try to prevent contamination. Anytime that your mask, whether it's an OR mask or a N95 mask, becomes dirty with any kind of bioburden, it needs to be thrown away. They were talking about using UV lights to see if they could repurpose the mask that way. And the thing with the UV light is that it's not good. It's only good after the bioburden is removed. Well, they haven't come up with a way to remove bioburden from the masks, the material that make up the masks. So just they're working on it, but that isn't out there yet. The reminder about your high touch surfaces, being extra diligent with those areas. If you have, if you're going to close down, or if you have closed down, a reminder that when you are going to reopen, do a terminal cleaning in all your operating rooms, then turn on your HVAC system if you had it off, and then clean again. The other thing is a reminder that your HVAC system, you want to make sure that you're giving it time to get back up to the air exchanges, and they approximated 28 to 30 minutes of that time. So, if some places that may have turned everything off, that's just a FYI. If you're going to change your filters, you're going to turn off your HVAC system more than likely. So you're going to go through that process as well. What else? Be diligent with wearing your PPE, because that's the last line of defense for you as the person wearing it. If you do have masks that have the ear loops as opposed to the ties, they're more recommended if you're going to reuse masks, because there's less chance of contamination, because removing with the ties, it might be easier to contaminate them. If you are reusing your mask, make sure you fold them so that the outside is to the outside, and not so that the inside that's going against your face is not contaminated with the outside of the mask, if possible. Hand hygiene, constantly do that before or after you're putting on definitely before and after you're donning any of your PPE. If you did go up and touch your face area or your mask, you do want to make sure that you do PPE as well. My big thing is, remember, your gloves are not the cure-all. Once your glove is contaminated, it's contaminated. So if you're touching your face with a contaminated glove, it's just like touching your face with a contaminated hand. Please be careful about that. If you do decide that you want to do reuse or repurpose those masks, they said make sure you perform a risk assessment. Everybody loves risk assessments. That will determine whether or not you're going to do that. They pretty much stated that reuse of PPE is when you're in a crisis situation. And that's a crazy word right now, because we feel like we're in a crisis situation, but their rationale, crisis means you don't have any others to use. Not that we're in a crisis time.
Lori, I just have a question from Donna.
Yeah.
She wanted to know, wouldn't you need to keep your HVAC running if you close so the sterile supplies stay within the appropriate temperature and humidity range?
The answer to that is yes.
Thank you, Donna.
Short and sweet.
Yeah.
But as you know, and I know, that what Big Father doesn't know doesn't necessarily get passed on, but theoretically, yes. As a center, you're supposed to maintain those sterile products and supplies in the correct environment. And you can't say, but when it comes in the trucks, they're not. You can only control your own facility and your practices at your facility. So yeah, Donna's correct with that. The other thing is that make sure that you're, as we said before, using your EPA registered disinfectant. And if you're running out, you might want to reach out to your local health authorities or your area hospitals. There are some homemade ones, but they are more cleaning agents, not disinfecting agents that are on the websites. You don't really have to worry about your equipment, and as in your instruments, because the processes that you have in place for the cleaning, disinfection, and sterilization is fine for the COVID-19 at this point that they know of. As long as you're doing your practices accordingly, you don't have to do anything special for that. They did recommend that if you're taking specimens that you double bag them, just to, to be sure. Let's see. There was a couple things that they recommended that I don't think are good ideas. They talked about putting plastic covers over your equipment in your room so that, when the next case is, you just take off your plastic cover. I don't think many of us have a big enough plastic bags to put over our machines, but it does sound kind of nice. If you do have patients that you know or suspect and you're willing to do those procedures, they do recommend that those get done towards the end of the day, and when you have the least amount of people around, so that you're preventing further contamination in multitudes. So that was one thing that they did speak about.
We have a comment from Katie, just saying that the autoclaves should be cleaned and spore tested before opening.
Yes, absolutely. Anytime you turn off equipment, especially of that nature, you'd have to assume you're starting from bad choice of words, but ground zero. Mm-hmm. So yeah, you'd have to run whatever your MFIU says, if it's 3 loads and a spore, or whatever your normal process would be. If some places close down, turn their stuff off on a Friday and they come back on a Monday, but you'd have to verify that your equipment is functioning properly. So yes, that's definitely it. And we're going to come up with a list for everybody for the, hey, yay, we're getting ready to reopen list of things to do. But yeah, that's a definite. Anytime your autoclave is turned down, turned off, whatever, you need to do the retesting and make sure that those are meeting the guidelines.
Thank you. And Beth asked, double bag all specimens or just the COVID-19?
Well, most of their discussion was more hospital based, and they were talking about if you had known or suspected COVID-19 patients. So, that's. Do I think you have to double bag your specimens? No, but if you think there's a risk that the person in that operating room could be a potential exposure, then yeah. It obviously it wouldn't hurt. I mean, there's some centers that are wearing the N95s. And again, the N95s are recommended just for known or suspected. So, if, it's half a pound in, half a pound out, it's, where do you draw that line? If you're getting to that level, why would you go down to this level for some of the things, some of the practices that you're performing? So, it's, again, do a risk assessment. Do a risk assessment based on what it is that you're doing and what you think.
Okay.
Do we have any other questions for Lori in this area? We've gotten quite a number, so. Okay. And again, you can ask questions anytime. We can certainly cut back to Lori at any time. We wanted to talk a little bit, a lot today about coronavirus aid, relief, and Economic Security Act. That's the CARES Act that was just passed just before we went on the air, as well as some opportunities in the SBA side. So I'm not sure who I'm going to, but I assume I'm going to start with Alex.
Sure, I can lead us off here, and then I'll put us over to Zach. But just want to say that the House of Representatives just passed the CARES Act this afternoon. So we just got word right before the podcast. And in addition, we've been reviewing the actual law itself, and we're not lawyers, so we want to put a disclaimer first saying that you should treat our information as anecdotal, not as fact or legal advice.
Are you saying that you did not read all 900 pages like I asked you to?
880 to be exact, but no, we did not. But we found a few interesting items that we wanted to touch base on. Zach, if you'd like to start us off with Title I.
Sure thing. So in Title I of the CARES Act that we went through this afternoon, we found a item called Paycheck Protection Program during this. So this is basically, this has to do a lot with the small business loans that are eligible for small businesses to apply for. So let's see. So eligible recipients can apply for these loans. And let's see, going through some of the text of the law itself, except otherwise provided at this paragraph, the administrator may guarantee covered loans under some terms of the conditions. So the administrator, they're talking about the Small Business Administration itself. Let's see. So during the coverage
This is Mark Schmidt with Fundex.
Yeah.
Maybe I could summarize a little bit here.
Absolutely, please.
The Paycheck Protection Act, or PPP, the objective is to assist small businesses with payroll expenses, as you can tell from the name of the act. It basically provides that the SBA will 100% guarantee loans to small businesses in the amount of roughly 2.5 times your payroll expenses. And that's an average over the last year. A lot of details in here. And at the end of the time frame, those loans will be forgiven. In other words, you take this loan out today or as soon as the bill becomes active, and you use the money to pay payroll. That's the intent. If you have the same number of employees on the payroll at June 30th, the government will forgive that loan. In other words, they're going to pay 8 weeks of salary for all of your employees. And that's basically all payroll expenses: salary, vacations, health insurance, all the things that we associate with payroll expenses. I would also add that the bill has just passed. There's a lot of details to be worked out yet. The Treasury Department and the SBA still need to work out the application process. And said Treasury Secretary Mnuchin is on record of saying that by next Friday, there will be a process by which these loans can be applied for and funded the same day. Now that means that the Treasury and SBA have a 24/7 job ahead of them to put the details together. But what's important to know now about these programs is that the law has passed, the money has been allocated. There is a presumption that virtually every small business in the country needs assistance. The objective is not just we don't want people to go on unemployment, right? The objective is to keep them on the small business, the restaurant, the HVAC company, on the payroll. And the incentive to do that is that the government will forgive 8 weeks worth of those expenses. The details can be pretty complex, as you can imagine, with just about any government lending program. You know, there's a definition of small business. In general, that means any business with less than 500 employees, and that's going to be 99% or so of the companies in the United States. It does include sole proprietors, it includes independent contractors, self-employed individuals, even nonprofits. So it's a very broad spectrum of eligible entities to get these Paycheck Protection Program loans. They will be available probably within about a week or so. The SBA still has to work out specific details on the application process. What I would suggest for most folks today is to think about the fact that the application process is definitely going to require some documentation and information about what your payroll expenses have been over the last 12 months. So if you don't have that information handy, I would compile that information, be ready to use that, be ready to submit that with your application, and also look into your options for SBA lenders, because these loans will be made by the SBA lending community, and that includes most banks in the country, and it includes a handful of non-banks, and Fundex Solutions Group is one of those non-banks. There are only 14 of those in the country. So I would suggest you look into whether your bank offers these loans, look into other options such as Fundex Solutions Group, and be ready to apply when the details are worked out. I will add that they're very attractive, I think, to the small business. They should be very effective in carrying out the objective of the program. There's no collateral required. There are no personal guarantees required. Many of the other provisions that apply to an SBA loan, which can be complex, will not apply here. And of course, they have to waive most of those requirements in order to make it a same-day application process.
And Mark, I think we also need to remind everybody of the importance, and we've talked about this before, of maintaining and keeping meticulous records during this time of the expenses that you're incurring, especially those that are above and beyond what you're normally incurring, and what you've done in order to maintain the payroll during the period of time.
That's an excellent point, because especially what you've done to maintain payroll, what your employee numbers are, because the government's going to look at the time frame between February of this year and June of this year. And if you still have the same number of employees, you'll have 8 weeks of expenses forgiven, but you have to be able to prove that you still got them. So that's a good point, John. Documentation is key, as it is with most all government programs.
Yeah. Who wants to speak next?
Zach, if you want to start again with Title II, which is talking more about tax relief.
Sure thing. So based on what we found, there's another section in Title II of the CARES Act called Employee Retention Credit for employers subject to closure due to COVID-19. So the title seems to suggest if you had to close for any period of time, according to the text of the document, in the case of an eligible employer, there shall be allowed as a credit against applicable employment taxes for each calendar quarter in the amount equal to 50% of the qualified wages with respect to each employee of such employer for such calendar quarter. I don't quite speak legalese, but that seems to suggest, like Alex was mentioning, tax credits, tax implications. And then moving along, there's another section called delay of payment of employer payroll taxes. I believe, I'm not, if I'm not mistaken, this might be the section that talks about taxes being delayed from the typical April deadline until July. I know that was part of the proposed deal. I'm not sure if this is the exact portion where it was located, but I know that was a factor. So yeah, Alex, if you wanted to move on to Title III.
Why don't we talk about this, Mark? Let's talk about just a couple more SBA related issues before we move on to non-financial assistance section. The SBA, another very important provision here that affects SBA lending is that if any company has an existing SBA loan, 504 or 7A, the government is going to make 6 months worth of payments starting today, once the law is active. So the government is stepping in and directly making payments on SBA loans for the next 6 months, including any new loan that's made in the next 6 months. So that's very, for any of you that have an SBA loan or thinking about taking one out, that's a huge incentive. Let me also mention that you've probably heard about the SBA Economic Injury Disaster Loan Program. I'll just say that the disaster loan program is one that the SBA administers itself. Okay, it's not a new program. It's out there for hurricanes and floods and other disasters, and it's been activated also for every state in the country. You can go to disasterloan.sba.gov and potentially apply for a loan there up to the amount of your economic injury, up to $2 million, and those can be up to 30 years. Otherwise, I would just say we know for a fact that the government is still considering additional legislation to make SBA loans even more attractive, including higher guarantee amounts, lower fees and interest rates. So the government is not done with economic assistance to the small business community. This is a great start with the CARES Act, but there's probably more coming, so stay tuned.
Now we have a question from Brian. He said, I believe there is a provision to bring back furloughed employees within a certain time and still be eligible for the loan forgiveness. Does anybody know the time frame for that? If there is a time frame.
So, I mean, what this gets down to, Mark, and I know they're looking it up as we speak, is that
Yes.
many people have already made the decision to furlough because, of course, they had to. And the question is, have they hurt themselves as a result of making that decision before the CARES Act was signed? And by the way, we should point out that it has been passed by Congress, but it still has to go to the president before it's actually enacted. I
don't have it right in front of me, but there absolutely is a provision in there to address that issue. I think there's a certain number of days if you bring your payroll back up to that level. In other words, they want you to bring them back on the payroll if you can.
Right. Okay, so we will look that up, Brian, and we'll get back to you. And the reason we probably don't know is maybe that hasn't been found yet in the actual legislation, but we'll keep looking for it, and I'll get back to you on that.
And he just commented, it seems counterintuitive to bring them back too early and then only have 8 weeks of loan forgiveness. So.
Right.
The website.
Are there any other questions? I'm sorry. Oh, right. Somebody was asking the website address. It is ascpodcast.com, again, where a lot of this information is. I have not been able to post this information from the CARES Act. We'll try to get that up tonight. It might not go up tonight, though. We might have to wait until a little bit more information comes out, which I'm sure is going to happen over the next probably 12 hours. So as soon as we get any summaries, and Mark, I might ask you to help out a little bit on this, too, with some summary information, if you wouldn't mind.
Sure.
That would post on the ASCpodcast.com website. Any other questions? This is great. Any other comments? Anything I think we have another section, Title 3, right?
Yep. And this section is a lot less having to do with small businesses and a lot more having to do with the healthcare system. It really won't be too applicable for most ASCs. However, it will be. It's actually quite interesting for upcoming disasters that might happen down the road. So, for instance, they've started to address supply shortages that we saw at the beginning of the disaster and come up with a plan for mitigating those in the future. For example, manufacturers that begin having drug shortages. This is manufacturers of medical devices that are deemed essential to the response of a disaster by the Health and Human Services Secretary. They have 6 months prior to running out of their supply in order to notify the Health and Human Services Secretary 6 months prior to running out, or if that's not possible, as soon as possible. And then in addition, they are beginning to address a lot of concerns for gaps in policies for future infectious diseases and bioterrorism, to increase the reporting and review requirements for manufacturers with drug shortages. So, for instance, that Health and Human Services and CMS falls under that as well. Will have a shorter period of time in which to respond to notifications of drug shortages or device shortages.
Mark, we did have a question about the SBA website that you mentioned.
Can you just give that again if you
have it?
Otherwise, we
Yeah.
can put it up. We will put a link on the.
Yeah, we'll definitely put some links up on the website. There is a link right now for the SBA loan program, which actually I think that's probably what you're referring to, right?
The disaster loan program, yeah.
Yeah. Okay, so that link is up on.
I'm sitting here looking at the law with regard to Brian's question. And
no, this was another listener was asking what the SBA website is. So, Chi-Chi, if you go to the ASCpodcast.com website and follow the link for the action plan, it is listed there under financial options, or I can't remember.
It's disasterloan.sba.gov, John.
Thank you.
Disasterloan.sba.gov. And with regard to furloughed employees, if they were furloughed after February 15th or in the next 30 days, which is after the enactment of the act, so between February 15th and basically the end of April, if they were furloughed during that period of time, they will not reduce the loan forgiveness if you have them back on the payroll by June 30th. So yes, you're right about that. The incentive is not exactly 100% there.
Okay. Any other comments about the SBA program? Any questions about the SBA program?
Okay, then I'll continue. Will note, sorry, there is an angsty dog in the background that might be making his voice heard.
And just FYI, you might want to your connection to the studio here is a little unstable. We're having a little bit of problems with it. Maybe he bit through the cable.
Okay. Yeah, he might have. Hopefully this is a little bit better. So the next part of this title addresses access to healthcare for COVID-19 patients. One interesting tidbit that I found in here is there is mention of an in vitro diagnostic test. I haven't heard anything else in the news about this, but it seems that they're keeping their options open for how they're able to test patients in the future. In addition, there is a requirement that each provider of a diagnostic test for COVID-19 make public the cash price of such a test on their public internet website. And as well, if the price in regards to the cash price itself, there's an opening for health plans to negotiate the price, but again, the provider must list that price on the public internet website. So for anybody looking to become a testing site, that might be something that you run into down the line. And the next part in subpart B, support for healthcare providers. I found the number, the dollar amount basically that is being provided through this plan for all, for detection of SARS-CoV-2 or the prevention, diagnosis and treatment of COVID-19. And that it's a fairly large number, $1.3 trillion going towards that. So that is for the entire healthcare industry. with regards to, again, prevention, diagnosis, and treatment of COVID-19 and the detection of SARS CoV-2. In addition, there was mention of improving the response for the Commissioned Corps and Ready Reserve Corps, which is a piece of the Army currently that can respond in times of disaster and provide additional healthcare providers to regions that need them. Which actually I discovered that they were initiated in January of this year for the disaster. So I found that quite interesting. And in addition, within 180 days, there should be guidance from Health and Human Services regarding sharing of the PHI for COVID-19 patients. So that'll be coming down the pike, which again, really not going to be related to surgery centers for the most part, but it is an interesting tidbit that I found in the law. Anybody else have any questions? Are there any questions out there, John?
No questions at this point.
Okay.
So we just got news too that President Trump plans on signing the CARES Act in right now. It's 4 o'clock. So followed by, of course, a press conference at 5 o'clock. So this is very exciting. I'm sure over the weekend, a lot more information is going to come out about this. We will, of course, parse through it and try to put as much succinct information as we can up on our website. Just a note about our website. So if you go to ascpodcast.com, you'll notice that the first 3 lines down, the first one is a link to the most recent podcast. And I usually am able to post a recording of this podcast probably within 5 hours. Probably should be up there by midnight or a little bit after that. So if you click on that link, you'll get the most recent podcast. You can listen to it on your computer. The second link down is a link into the daily updates that we send to our clients. So you can actually read all of the daily updates that we've been publishing since the beginning of our crisis team actions here, right on the website. We treat you like our clients right now, so you get an idea of what information we send out. And then the third link down in big bold letters is what we refer to as our action plan and resources. And that is a list of information that we try to organize it in such a way that you can you get to the facts very quickly. And again, just a wealth of information there. I was on Ask Connect this morning, and I just noticed that there's a lot of people asking questions that we answered weeks ago. I mean, a week ago. So please pass that information on to anybody that might be interested in it. Sorry, we just got a text message in. Let's see if that's important.
Sure, I've got one more note from Title III that I can add in while you guys are transitioning. So the last note that I found fascinating was that there is a provision for healthcare professionals to waive liability under federal or state law for certain types of harm that could come from volunteering to help with COVID-19 if practicing within scope of practice as a volunteer and in good faith. And then there's certain exceptions such as ones that we would expect, like actual criminal liability and things like that.
Okay, we're monitoring for any questions here. Please send them through either on YouTube, through comments at ascpodcast.com, or in the Podbean app. Of course, if you're live, if you're listening to this recorded, it's kind of too late. But I did want to finish up here by talking a little bit about some of the exciting things that are coming down the pike. Now, so we're in the process of setting up some virtual conferences, because we know it's going to be kind of hard to actually attend real conferences for the rest of the year. We know those of us that have certifications are going to need AEUs, IPCUs, nursing credits, even physician credits. We're going to do what we can. We are a registered AEU and IPCU vendor, and our first conference is going to be an infection control coordinator virtual conference, which Lori Rodericks is going to be heading up. She tells me that she's halfway through the material for that. Yeah, I just put your feet on, Lori. And so I'm very excited about this. We're one of the things that Lori and I talked about is we're going to try to make it as interesting as possible, and make it kind of feel like you're there with Lori in the room, which is kind of frightening, but as opposed to a typical webinar. And so we're going to try to figure out some unique ways of doing it. It will be hosted on our Zoom feed. We've already set it up, but we just haven't pushed it out yet. So there are 4 sections to it. Lori, what are those 4 sections?
So we'll start with the role of the infection preventionist. Then we'll follow that with developing an effective infection control program. Then the infection control risk assessment, we'll go over that. And in there, we'll talk an awful lot about what's going on today. And then we'll end with performing an infection investigation. We have other thoughts for future ones, but please, you guys out there, let us know what it is that you want to learn. And then I'll pretend to make it up. But, we're here for you as well. So that, it's to help you. And again, if you're not an infection preventionist, or if you guys in the audience right now are leaders in your organization, but you have someone that you think would be a good candidate, this is an opportunity to have him or her participate, and then they can kind of get a good feel for what the expectations are or what the benefits are. And, so it's not just for an infection preventionist. This is for everybody to learn, and it's a good opportunity to pass on that information and have your staff hear it from others than you.
Right, and that's a very good point too. In general, about we love to hear your comments. We do try to prepare our podcast based upon information that we provide from you. We've gotten some incredible feedback, because there's things that obviously we're not going to be able to anticipate here, and our audience has been great about that. So this event is live. It will be on Tuesday, April 7th, 2020 at 8 a.m. It is all day. God bless us. 7 hours of listening to Lori talk. It's
7 hours?
Oh, did I forget to tell you? So, but it'll be broken into 1.5-hour sessions. It is a live event. It's limited to the first 100 attendees. We will record it afterwards, and of course, that'll be available sometime soon after that. Attendees will receive a certificate of completion. They will receive AEU and/or I guess it's IPCU credits. You can use it to this is important. You can use it to demonstrate training as an infection control coordinator for CMS infection control purposes or accreditation purposes. That's really our whole goal here, is to make sure that, we're directly giving you those skills that you need in order to become, at least in the beginning. Let's face it, you're going to have to do a lot more in order to continue in this role. But if it's new to you, or if you want to prove that you're keeping current, this is the type of conference to do that. It is free for paid ambulatory healthcare strategies retainer clients. Again, let me say that again. It is free for paid ambulatory healthcare strategy retainer clients. It'll be $199.99 for non-clients. The normal price is $249.99, and it will be available as a recorded session after the live event. I'll be sending out requests to our clients for people to sign up once I figure out how to do that. And we are in the process of requesting 6 hours of AEU and IPCU credit through the Board of Ambulatory Surgery certification. So for more information, feel free to email me at comments at ascpodcast.com. And we do have other conferences planned. We're working on a New York State specific conference. We would love to do some other state conferences. I know we've reached out to a couple more. And of course, we're looking for a 2-day virtual conference sometime in the next month and a half. So stay tuned for that. Does anybody have any questions?
There will be bathroom breaks.
Yes, I did build that in already to the schedule. So
Oh, good to know.
unfortunately, I can't serve you food through the webinar format, but we will.
I am keeping Dunkin' Donuts very healthy with my iced teas every day. So that's another way to keep your stress level down. Go visit your local Dunkin' Donuts.
There you go. I'll probably bring our Rosie, our little 8-week-old puppy, on the screen every once in a while during the webinar also.
Great, that'd be good.
Break up looking at Lori for 7 hours.
I'll even do my hair.
I keep doing this banter in order to see if we get any more questions. I don't think we have, and people are dropping off, so I'm assuming that it must be getting to the time for everybody to leave. If they're, hang on.
It's just me. I got an
Okay.
New York State Attorney General warning I thought I'd share about if you're a healthcare provider, hospital, or other organization within the health supply chain, you may be more advanced phishing attempts. That people are phishing you for information, scamming, basically more email scams by people trying to tell you how you can help your friends and colleagues.
And thank you.
SIS has sent out a same warning.
Yeah, thanks. We probably should address that in a podcast next week. I have reached out. Nelson Gomes, a good friend of mine from the IT world, hardware world, largely a networking world, works, of course, quite a bit with SIS. He has reached out to me. We just have not been able to connect, and I think it might be interesting to talk a little bit about some of the technological issues that are surrounding this issue. I know, of course, maybe I'll put you together, and I'll put you together with Nelson, and we'll figure out some technological things to talk about. But definitely be very careful. There are scams out there, and be careful about what you click on. Be careful about people trying to take advantage of the situation. So please be very diligent on this.
That's exactly right. John, I posted a question about, will credits be available, AEUs and IC credits, if for the recorded session or just the live?
Oh, good question. Thank you. And both, FYI, full disclosure here, both Ann Geyer and I serve on the BASC board, the Board of Ambulatory Surgery Certification. And assuming that Ann and I are able to get the board to certify the IPCU credits, which should not be a problem. They've certified everything we've done in the past. Yes, it would be available both for the live and for the recorded one. With the recorded one, I believe you're going to have to take a quick test. That's all, in order to prove that you actually went through the material.
That makes sense, but that would be very useful for the attendees.
Yeah, no, definitely going to do that, and we'll also have, just like you would if you were attending a real conference, you'll get slides, and you'll get a wealth of materials. We have a lot of resources that we provide to our clients anyway, and we would be glad to share some of those tools with you, the things that we've modified.
So the only thing that we don't get is lunch.
Snacks. Yeah,
Correct.
no snacks.
Snacks and a coffee break, but we'll give you time.
So come prepared.
And everyone can wear their pajamas.
That's right. Yeah, don't worry. We'll just see you.
Is it just me? But I've been thinking about food constantly since this started. And see, what did I just ask? Is lunch going to be provided? I know I was tongue in cheek. But, oh my gosh, I'll sit here and eat lunch, and within 30 minutes, I'm thinking, okay, what can I have now?
That's the old nurse in you.
Oh, I think you're right, Lori.
Yep.
No, thank you all. Yeah, so definitely, maybe what you should do is just prepare the food before the teleconference there with, so that you can feel like you're there. Seeing no other questions, any other comments? Seeing none. Well, that's it for this episode of the ASC Podcast with John Goehle. Join us again. We'll probably have another live podcast on Monday. And consider becoming a patron by going to our website at ascpodcast.com. Those patrons do help to pay the bills and keep the lights on in this wonderful studio we have here. And spread the word about our podcast with your friends and your colleagues. And please do us the favor of hitting that subscribe button so you'll get notice right away when we go live and any new episodes that are published. The sound editor for this episode is Susan Cronkite. Executive producer is John Goehle. Research assistance is provided by my incredible team, Susan Cronkite, Jenna Alvarez, Judy D'Ambrosio, Alex Borneman, Zach Kalritis, and Lori Rodericks, and with assistance by Ann Geyer and Mark. Mark, I forgot your last name.
Schmidt.
Thank you, Mark Schmidt. We'll get to know you a lot better over the time.
You.
Thank you,
Thank
Mark.
you.
And thanks for your time today. I'm sorry. Music is provided by Media Sushi, and Mike Noah. The ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast channels.
This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. We would like to thank our sponsors, Ambulatory Healthcare Strategies, Surgical Information Systems, Encompass Healthcare Data Solutions, and BHG Funding. For more information about our sponsors, please visit our website. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.